How would you like to find out that you had cancer after living a very healthy lifestyle and that without, dozens of chemotherapy IVs or cancer therapies, you weren't going to live? James Templeton heard those words. I met him at a meeting that I was the MC at in Orlando here last year. He's going to give us 10 minutes of really compelling data on taking good care of your health. Jenny's going to be here today talking about the stress associated with cancer. And then let's talk about a fungus that gets into the lungs and mimics all sorts of diseases. It's called Cryptococcus neoformans. Big words, but we'll put it together for you as the show progresses. While we're talking about lungs and asthma and all things that, Dr. Mukesh Saraya, board certified pulmonologist and family medical practitioner, is going to be here to talk about asthma. Do you suppose fungus can mimic asthma? All that and more. Don't go away. We'll get started in just a moment. My name is Doug Kaufman. For the past 40 years, I've dedicated my life and even my career to finding the root cause of disease. Join me in a team of physicians, pharmacists, and scientists, and soon you too will know the cause. Okay, joining me right now is a dear friend of Dr. Ann Louise Gittleman's. This man heard those three words none of us want to hear, but a lot of you have heard. You have cancer. But this was 32, 33 years ago, and they told him he wasn't about to live. Joining me right now is James Templeton. James, thank you. Your story I heard at the big ACIM, all those people, you stood up on that podium. I was so proud of you, doing so well. There's a podcast James and I did. You must listen to it. It's on our website. It's free. Knowthecause.com. Go review it after listening to this. You were told those words. You had a little skin mole. Found out it was cancer. Then in the groin, a lump grew, and the doctor said, oh boy, this is really bad. And then they recommended 80 rounds of chemotherapy. Pick it up from there.
Well, I was in the hospital, and he says, you need 80 treatments of chemotherapy. And he said, we're going to do experimental chemotherapy. And he says, that's hypothermia chemotherapy treatments. We're going to elevate your temperature as high as we can without basically killing you, probably get up to 105 or more. And then after that, we're going to induce the chemotherapy. He says, we're going to do 80 treatments of that. And he says, also, though, the real thing here is you have a 20% chance of surviving 3 to 5 years if you can get through these 80 treatments.
Okay, and the cool thing about this is you had already gone through 5 of them, and you felt kind of miserable, so the hand of God appeared to this guy, the face of God, and it was amazing. He got a letter, he got a book, he learned about macrobiotic diet, he learned about vitamin C from Linus Pauling, and in tears in his hospital bed, he said, God, you got to help me, I'm out of friends. Here you are 32, 33 years later. But do you think it was those first 5 chemotherapies, or might it have been a special diet and vitamin C that helped pull you through this?
Well, before that, I didn't have much hope. I was very depressed. And, when you're depressed, that doesn't do much for your immune system. And when I started to get hope from these things you're talking about, from the vitamin C and from the macrobiotic diet, I got very excited. And I knew then that I had something because they gave me very little hope, and the chemo wasn't really working, and I knew I needed to do something. And
how much vitamin C would you take?
I was taking 20,000 milligrams a day.
20 grams?
Yeah, 20 grams.
Did you get diarrhea from it?
No, never did. I probably could have taken more even.
Yeah. You found out, thanks to Dr. Ann Louise Gittleman, you and she met 5 years after you had your diagnosis. You were pretty much on the way to recovery, and you found out, you attended a symposium, I have to laugh at this,
yes,
that she was giving on parasites. She recommended that you and she travel and see a doctor in New York who is a parasitologist.
Yes, we went to see a doctor. His name was Dr. Herman Bueno, and Dr. Bueno did a purge stool sample test in his office, and he had one of these teaching microscopes, and he says, we'll look under one side and you look under the other, and he found amoeba, histolytica, giardia, lamblia, and he also found something called ascaris, which is roundworms, known as roundworms. And he's told me also he had never seen a case of parasites, rather cancer or AIDS that did not have some kind of parasitic involvement.
Really?
And I got very excited after that, thinking about all those other people out there that probably were going through a lot of the similar things I had, that had cancer, had other things going on. What about those people? And I thought that this was what I wanted to do later in life. I wanted to start to do my research. I wanted to help others.
Yeah, and that's, feed my sheep.
Yes.
After you win, then it's time to help others with this.
Right.
So the story is just so compelling, folks. So he figures out, okay, I got parasites. I wonder if when they saw that mole on my back that had gotten big, why that doctor didn't mention parasites. And along the same lines, yeast parasitize us, fungus parasitizes us. So many people recommend testing. But folks, when you see the numbers, what James has said is these doctors are saying we probably all have them.
Oh, yeah. Well, I used to have animals, and when you'd go to the vet, they always had them. So why wouldn't we have them?
Yeah, and it's funny how we deparasitize, deworm the animals that we're holding on our lap, but we never think about deworming us. Now, we're going to go to a break because I want to continue this, James.
Okay.
I couldn't get enough of this when I'm listening to him up on that podium. When we get back, a company called Unikey was formed because he almost died. I'll tell you about that in just a minute. So James Templeton, you heard the first segment of the show. If you didn't, this is an amazing man who heard those words, you have cancer. He went out and learned and studied, and his education continues. Welcome back, James.
Thank you.
Thank you so much for being here. So here you are driving back. You met this doctor with Dr. Gittleman in New York. You're driving back. You must have just sat there going, no way, that was growing inside me. And at some point, you and Dr. Gittleman got together and thought, wouldn't it be neat to put together a formula that would help people with parasites? Well, how many people have them? I mean, were you finding in your studies, gosh, with fungus and yeast being parasites also, we probably all have them.
Oh, yeah. I think that most people have them. Like I said earlier, when you have animals, you take them to the vet, and they almost always show some kind of positivity for parasites. And we're not out digging in the dirt as much as they are, but a lot of us are, and we're eating a lot of raw foods out there. Salads, what's going to stop it?
Sushi.
Everything. Sushi, people are eating sushi because that's the in thing.
Right.
So if you're trying to stay healthy, please don't eat sushi, because once you get the parasites, it's not easy to get rid of them. And you've really got to get serious about it, because this is one of the most immunosuppressive things that can go on in the body.
Parasites.
It is.
Yeah,
it's a big problem. And if you've had cancer, if you've had any kind of condition going on that just seems to just linger and go on and on and on, you got to really look at parasites. And you got to get tested, find out if you have parasites. You can go to a doctor and get tested, or you could go and just find a test. There's tests that you can do actually through our company, Unikey Health. And it's a big problem. And if you're going to get your health where it needs to be, you need to go from the ground up. Detoxify from the ground up. The first place to look is what is crawling around in that ground down there.
Exactly, because that's transdermally.
That's
You were talking about standing in dung, on your ranch with the cows, clean up after the cows.
yeah, and you get stuff on your hands. You go to restaurants. You don't know if people are washing their hands. You don't know what they're doing. So it's a big problem. It's not something that's sexy. People don't like talking about it, but it is a problem.
This kind of makes me sad. Tell me if this isn't you folks also. I wonder how many people in that year, 1985, heard you have stage 4 cancer and you've only got a 20% chance to live, and then heard we're going to help you, and who aren't here 32, 35 years later because they listened. Folks, it amazes me. Look, if you always do what you've always done, lump on the neck, you'll always get what you've always gotten. Another lump on the neck. You must change. Summarize the past 30 years. You change your diet. I just watched you eat. We just had lunch together. Man, you are the most careful guy I saw. Then I saw a handful of supplements you took. Will you do that the rest of your life?
I take a lot of supplements because When I decided to go to war against the cancer and do it myself and take the, as we say in Texas, take the bull by the horns, and you go out there and you take control, I knew that it was not going to be a easy battle, and I knew that I couldn't just do it for 2 years and then go back to my other lifestyle. Whatever I had been doing in the past had made me sick. It's not one thing, it's not two things, it's many things. And when you want to get well, the battle just goes on and on and on. It gets easier, but you have to stay with it. And yes, you have to watch what you eat. You have to detoxify. And that's what I did. I formed UniKey to get to the root of the problems so that people could get better, take a load off the immune system. It has to do with your diet, detoxification. Sugar is a big thing, that you have to eliminate the sugar to low levels. You got to eat foods on the low glycemic index level, and you've got to take things to help boost your immunity. And vitamin C, to this day, I take a lot of vitamin C.
30 seconds we have left. Summarize. Do you think skin cancers, melanoma, are linked with parasites?
I don't know that, but I know that parasites are suppressive to your immunity, and melanoma is an immune issue, just like anything else. And a lot of people have gotten well from melanoma by just boosting their immune system, detoxifying their system. The vitamin C, there's studies out there that have shown how effective vitamin C can be for melanoma and all kinds of different cancers.
1-800-888-4353 for more information or any of their products. James, great to be with you today. Thank you so much.
Thank you, Doug, very much.
Hey folks, those 3 words, you have cancer, that alone is going to stress your body. So Nurse Jenny is going to talk about that. Then we get back 1.6 million deaths a year due to this fungus, and our doctors don't know? Stay tuned.
Hi, I'm Jenny Herbacek with the Cancer Connection. Stress is a contributor to cancer, and I'm talking about the kind of chronic stress that's common to so many people because of our worries and our schedules about money and family. And if you're dealing with stress, ashwagandha is a natural herb that can help. In holistic medicine, it's considered a powerful adaptogenic herb, meaning it balances us on a multiple of biological and physiological levels. Ashwagandha is best known for its ability to reduce stress by lowering levels of the hormone cortisol, which gets elevated when we're stressed. The excess stress inhibits our body's ability and the immune system to fight, and that increases our risk of cancer. Ashwagandha has also been shown to fight cancer directly by impeding the growth of new cancer cells. So now you know more about ashwagandha. For Know the Cause, I'm Jenny Herbacek.
You know, I've been blessed to speak at so many medical meetings here in the year 2017. There were a whole bunch of them. And I found doctors up on the podium with me discuss fungus only to the extent that Candida albicans is a single-cell fungus. Yeast is single-cell fungus. But folks, there are 299 more discovered and logged in fungi that are opportunistic, pathogens to we humans, right? So it isn't just the yeast, Candida albicans or Candida tropicalis or Candida other strains. It's things like Fusarium and Aspergillus and all these ugly molds that can become problematic. One of them is called Cryptococcus neoformans. I've always loved that name. It's one of the first ones I learned to type. So I wanted to expound on a little bit. Here is an opening. This one fungus, Cryptococcus neoformans, thought to kill about 1.6 million people a year. In healthy patients, now keep this in mind, we're in cold and flu season, this fungus can cause chest pain, cough, and low-grade fever. In healthy people, we call healthy people immunocompetent, but we call unhealthy people immunocompromised because their immune system can be compromised by the slightest thing, one of which is this Cryptococcus neoformans. Most have fever, those who are sick, cough, difficulty breathing, we call that dyspnea. Infects mostly the lungs and the central nervous system, but it can spread to the skin, prostate, and bone. What doctor, what urologist in America even can say Cryptococcus neoformans? And what doctor in America would think a man's prostate could be impregnated with this? Oh, and it's thought to be extremely rare. Only bacteria can get in your prostate. Wrong, wrong, wrong. Boy, I should become a medical school teacher. How do you go from a lay guy to a medical school teacher? We'll discuss that on another show. Okay, an Australian team discovered that ARG1, it's called, ARG1, a protein produced, get this, by all fungus, enables Cryptococcus to establish potential lethal infections in patients with a weak immune system, such as those with HIV, AIDS, or leukemia. Can I go on 1 second further? If you have mold growing in your home, then you are immunocompromised. These mycotoxins made by mold impede your immune system. So if you go home and on a weekend by Sunday night you're sick and hacking and feel miserable in your home, it may be you're immunocompromised. Now, your doctor wouldn't know that because they don't even know that mold in a home can wreak havoc on you. Hospitals induce or cause nosocomial infections in healthy people. You go in with a cut on your arm and you come out of there with pneumonia. But it's not bacterial pneumonia sometimes, remember. According to Dr. Carol Kaufman, no relation, it can be fungal pneumonia very often. Cryptococcus neoformans is one of these that kind of mimic pneumonia, right? Even in healthy people, always tell your doctor that you want a secondary consideration, right? You want him to rule out that this junk you're coughing up and spitting out isn't fungus. He can do that. He can do that with a saliva test. Okay, just make sure they're doing it. Now, this I thought was fascinating, folks. This is the take-home message to Cryptococcus or Candida albicans or Aspergillus. But because fungal cells and yeast cells are so similar to human cells, developing a new drug that's harmful to fungus but doesn't kill us also is a challenge. Most studies today are being done on yeast cells, right? When a new drug is developed, man, you get a pack of these yeast cells and you test it on yeast cells. If that clears, you might go to animals. But how do animals get diabetes? You inject mold into them, right? We've talked streptozotocin mold into these bunnies and they all get diabetes. Then you can test your medicine. But it starts with yeast cells. If yeast cells, which have a cell membrane and a nucleus with DNA in it, and human cells are so similar, what's the potential of a new hybrid cell that doctors know nothing about being formed when our DNA converges with fungal DNA? Folks, I've been teaching on this on TV for 18, 19 years now. This, I think, is beyond science fiction. I think it's real. I think it's happening. Fungal diseases mimic every disease known to man. The problem is, our doctors just don't know that. Hope this helps. Good buddy of mine now, everybody should hear this. How often do you guys look at a physician and say, I wonder if he was a patient in that waiting room, how he would treat that condition? What if a lot of your patients are bronchial patients, right? Lung patients, pulmonary patients. So you got the chronic cough for 3 years, you got people with stuff growing in their lungs, you've got chronic sinusitis and just a head full of stuff that they can't get out. You've got asthma, COPD, chronic obstructive pulmonary disease. Well, this physician, Dr. Mukesh Saraya, does see that all the time. So I got to ask you, I've been wanting to ask you for the years I've known you. The patients sitting in your waiting room, they're probably all talking because you're a doctor who knows the cause and who's helping them get better. Once he learned about mold, his world changed. What if you had asthma? What if Dr. Saraya had asthma? What would you do now differently than 27 years ago when you graduated from med school?
Very good question, Doug. So asthma is traditionally been considered to be a reversible airway bronchospasm, meaning inhalers. Every 4 hours you're hitting on inhalers. Yeah, and then along came the inhaled corticosteroids like Advair, Symbicort, so on. And that did change the outcomes in terms of mortality and so on. But what a lot of people are missing is that not all wheezing is asthma. And wheezing could be produced by mucus plugs, produced by allergens such as aspergillus that are actually pathogens, within the lung.
Fungus.
Fungus.
Yeah.
And I'm finding that to be more and more, especially sitting in Texas where there's horses around, horse barns, hay and so on. So, what a lot of these folks, 18-year-old I recently saw, worked around horses and hay all day, for the last 15, 20 years of her life. And, when scoped, when go down with the bronchoscope, what we find is plugs of mucus. Wow. So this is kind of a bronchoscopic
so you go into
view.
his lungs or her lungs?
Yes.
Okay.
Yeah, passes tube, through the nose or the back of the throat, through the vocal cords, into the trachea, left and right lungs. So here's a plug of mucus that is blocking this airway. Wow. So the only thing open, this air passage, I would say, is blocked about 90%. So what's open is this much. Now this is causing the wheezing in her, in her lungs that most people would treat with inhalers. When you use an inhaler, what you're doing is you're dilating, making a little bit of space around the mucus plug, but you're really actually not getting rid of the mucus. So what is going on is every 4 hours, or either you're using your inhalers or you're using your nebulizer, and all you're doing is creating a little space around the plug of mucus. So this here is a plug of mucus that I had to literally pull out of the scope and flush this out because it didn't come through the suction channel. So these are plugs of mucus that had probably been sitting there for months, if not years. And this culture out, mold when it's cultured. But I think a patient with asthma, especially, when they're wheezing, mucus plugs might be the reason. So basically what I would do in somebody that's kind of fresh to my practice and has gone through rounds of antibiotics and steroids, I would go inside the lungs, I would look for these plugs, that would not show up on regular chest x-rays or even a CT. Pull them out, send it off for cultures, identify, what is causing these. 90% of them will show mold.
What is the cause?
The cause is a mold. And a lot of it is environmental, such as seen here with the vents. Your air ducts are full of mold. These are homes that some of them are basically been this way for years, and they're inhaling the spores, which in turn is causing the irritation, the bronchospasms, and they become pathogens, producing a lot of mucus that plugs them up.
What percentage of your patient population do you isolate mold from their bronchoscopy?
It's safe to say close to 90%.
So then we'll go back to that question I started with. If you were that asthma patient sitting in your waiting room, or the COPD patient, chronic cough patient sitting in your waiting room, you'd probably lean on curcumin,
absolutely,
maybe supplements, maybe a changed diet. Would that help?
No doubt about that. So curcumin, oregano, NAC, N-acetylcysteine, commonly suggested in my practice, and patients come back with feedbacks that's unbelievable.
He told me one time that he's always been into supplements, and now he's really using a lot of them. I mean, this is really good. Dr. Soraya, thank you for coming in.
Thank you for having me.
Diet and Fupo head, fungus until proven otherwise. Thanks again.
Thank you.
Do you realize that two of the guests on today's show, Jenny Herbachik, the nurse that talked about ashwagandha, and James Templeton, are long-term cancer survivors? They were told, you better do this, or they didn't do that, and they're alive and well today. It's one thing to be, one of those people who just said, I'm going to step out of the box and see how I do on my own because the other option doesn't look good. It's a whole other thing to be a doctor who begins understanding it. Thank you, Dr. Mukesh, for coming in today and sharing your knowledge with us. More and more doctors are understanding this, and it's creating a lot of excitement in the field of clinical medicine today. Think fungus, become a Fupo head. Fungus until proven otherwise. God bless you, folks. I'll see you next time. Thanks for telling your friends about Know the Cause.